As we look into the area of the dorsal foot, this is the same body, opposite foot. Just to outline some things, we have anterior tibialis anterior tendon, extensor digitorum longus with its tendons. These have been cut, and I'll pull them down to reflect. We can see in the second toe how the tendon coming there broadens out into an expansion, so there's extensor expansion. This is a beautiful view of extensor hallucis brevis and extensor digitorum brevis. I've cut the extensor hallucis brevis tendon so I could pull that muscle back out of the way. As we look here, we can also see another set of muscles of the dorsal foot would be the dorsal interossei. Okay, they're not true of the dorsal foot, but they are seen from that perspective. The deep fibular nerve coming from the anterior leg, we can follow some of its branches down into these dorsal foot muscles, but we can follow this other branch here as it becomes the dorsal digital branch of deep fibular, which is going to innervate the skin between the first and second toes. From the arterial perspective, we have the anterior tibial artery that as it crosses the ankle becomes dorsalis pedis. As it approaches the base of the first and second metatarsals, we will see that it continues with the dorsal interossei here as the dorsal metatarsal artery. If we look where that transition of dorsalis pedis becomes dorsal metatarsal, right there at the back end of this first dorsal interosseous muscle, we will find an artery branch that dives deep in between, and that's the deep plantar. This one does not show an arcuate artery coming across, but if we see anything crossing the dorsum of the foot that's arterial, that's the arcuate. And it does show up here proximally a branch seen right here running across the midfoot at a lateral direction, so the lateral tarsal artery.